So if you're like a lot of people out there, you're very confused about the vaccine. I know I am. What list should I be on? What list should my parents be on? What about my friends? Is there any kind of priority? What's going on? Well, stay tuned because our guest today is going to give us some answers. Hey, good morning, everyone, and welcome to Scan FYI. I'm Andrea.
Good morning, Andrea. I'm Marybeth and with us this morning is Christopher Rinn, CEO of the VNA Community Health Center. So good morning, Christopher.
Good morning, Christopher.
Good morning. Thank you for having me.
Thank you for joining us, and you're going to give us clarity about the COVID-19 vaccine.
That's all, just some clarity.
Just some clarity.
I'm going to try.
So I guess that's really the question is,
where do we start?
what is the best way for people to proceed who need to be vaccinated?
No, that's a great question. And for those, who are wondering, where do I get my vaccine? I think the very first thing we have to understand is there was a very, very detailed rollout plan that our partners in government, federal government, and state government put together that really prioritized those, or tried to prioritize those at most risk for COVID-19. First, the healthcare heroes that are on the front lines treating this deadly disease, really making sure that they get access.
Don't worry.
I get a lot of text messages these days, and they come in all shapes and sizes. So back to the question. How do you get a vaccine, or a lot of people have that question. It's really the government rolled this out in a very stepwise fashion. First, providing the vaccine to those at greatest risk for COVID. Those healthcare workers, healthcare heroes that are on the front lines treating patients with COVID, those in hospitals, out in the community and in public health. So you have to be, in order to be eligible, in order to get the vaccine, you have to be eligible for it. So understand where you are in terms of eligibility. Right now, the governor of New Jersey and the health commissioner have authorized those in Group 1A and some of Group 1B to be eligible for the vaccine. Now, what does that mean to you? Listening, say, am I in that group? 1A, 1A are healthcare workers and first responders, EMS, police, fire. As we get into police and fire, they now transition into Group 1B. And then also those who are age 65 or older, a higher risk group for COVID. And then those between the ages of 16 and 64 with certain pre-existing or certain medical conditions that would make them susceptible to a more serious disease process with COVID-19.
So you're saying that was the intention?
That was the intention, and we're following that guidance. Those who are vaccinating are vaccinating only those who are in the Group 1A and those certain categories in Group 1B.
So why do we hear about younger people just getting access to the vaccine, and so many seniors who would be in that category are just seem to be unable to make an appointment, or you're not on the right list?
I think we see a lot of younger people. First, I got this question the other day. We have to remember that still healthcare workers are still eligible no matter what the age. First responders and those who are coming back. In our case, in the Moderna vaccine, people are saying, look at all these young folks online. Well, many of them could be the second doses, people coming back for their second dose regimen, and their healthcare workers or first responders. To your question of seniors and those with medical conditions, remember those with certain medical conditions could be between 16 years of age. For us with the Moderna vaccine, it's 18 years, 18 years of age to 64 years of age with those certain medical conditions. So if you have them and you're eligible, you can certainly go to our website at www.vnachc.org, and we open our registration on a daily basis. We have in fact, we open it really based upon the supply that we have. And I think it's not lost on anybody that the demand far exceeds the supply
Yes,
today.
right. Well,
So
that's obviously that's a big issue. I will put that link in the Facebook comments, so don't worry, nobody has to memorize anything. So is that still now the best way for people to get in the
Secure.
queue,
Yeah.
right?
So, if you're still confused about what group am I in, if that's not clear, the state's website actually helps you. If you go and fill out their registration, the state's website will tell you what group you're in and will send you a notification when you are eligible, and then point you to the direction of sites in your area and actually throughout New Jersey that you can then go to register and get an appointment. The state system, I think the biggest misconception out there is the state system is a registration portal and a portal that really allows you to understand what group you're in, and then once you're eligible, lets you know that you're eligible, and then points you to where you could then sign up based upon availability for a vaccine appointment. And we all know, that's the biggest challenge today is there's
Right.
not enough vaccine for the demand and for the folks who want it. And we're seeing that, and we're dealing with that every day at our vaccination sites. Just the demand, people walk up, and we're by appointment only. You have to go to our website.
That makes
You
sense.
have to pre-register, and by pre-registering, we get all of your information up front. It may seem a little bit of an involved process. It's a 12-step process that actually takes you through. Sorry.
That's okay. You're a very
No,
busy
it's
person,
fine.
Christopher.
Sorry,
No,
it's
it's
the notifications. And I will try to just turn this off. It's a process that, again, takes you through. It asks you your demographic. It allows you to sign your consent forms, all the necessary paperwork, so that when you come to the site, the registration process or the check-in process is rather smooth. And what that enables us to do in the vaccination site is see more people and have a higher throughput and
faster.
vaccinate more people.
Yeah.
So it really helps when the public goes and accesses our website and registers that way. It is helpful to us, and it's helpful to their community because it increases our throughput. Now, I'm sure you're going to ask me the next question, which is if you have trouble with technology, or you have some access or functional need, using the on-screen technology. We're working with many partners in the community. You can always have a family member or somebody help you through the registration process, help you take a picture of your ID or your insurance card, and help you register and you utilize the buddy system. If you don't have a buddy, we're working through a number of senior centers and senior services offices
Okay.
in various municipalities in Monmouth County, and they can also help you register. For
Is
example,
all of that info, if we go to your website, we can find all of this out?
we have a frequently asked questions
Okay, that's
on our
good.
website, and a lot of the questions you're asking here are there, and we'd be happy to answer any of those that you don't by just hitting our Facebook account or sending us an email.
If someone doesn't have insurance and they want the vaccine, is that an issue?
It's not an issue.
Okay.
In fact, our registration process, if you don't have insurance, there's a little box you check there. No, I don't have insurance, and it brings you right to the next step.
Okay.
So
No, that's
we're-
good to know. That
we're
is
not
good.
letting, access, we're not letting, some of the traditional barriers to access to healthcare really impede our initiative to ensure that we really vaccinate.
Do you foresee a time when your local CVS or Walgreens, et cetera, you'll be able to go in there for your shot, just like you do that for a flu shot?
We understand that there are several pharmacies in Monmouth County. I don't have the list memorized. I did see an article today that CVS will be expanding their vaccination access in the coming days. So my understanding is that pharmacies are already providing vaccination efforts, and that will only increase as the supply increases.
All right. So it is really about the supply, a big part of this.
It is. I think that is, if we had more supply, we would be able to vaccinate a lot more folks and open up our registrations a lot more often to a lot more spots, and we wouldn't have this, this really bottleneck that we're experiencing in the community right now.
Okay.
But we're
And
determined.
I guess also patience. We have to be patient.
Yeah, I mean, we've been through this pandemic now approaching. I mean, we're approaching a year.
Here.
So we've waited a year for vaccine. We waited, we were talking a year ago, about, this kind of first wave and then second wave. We just need to all recognize that we're in this together and we're getting through it together, and that exercise patience, a little perseverance and persistence in terms of going to the websites and knowing where you fall in terms of the
Eligibility.
eligibility,
Yeah.
and leave the rest to those in public health and in healthcare to get our vaccine supply in larger quantities, and then we'll get more supply and deliver more services and more vaccine to the community.
Maybe just a final question. Let me ask you so you had mentioned it was about a 28-day, give or take, in between dose 1 and dose 2, something like that?
Exactly. It's 20. For Moderna, the Moderna vaccine that we're providing at the community health center, it's 28 days is the recommended time. And there's a little, obviously we just had a snowstorm here in Monmouth County. We had to push some folks that were registered for their second vaccine from Monday to today. So a day or two on either side is not going to, from my understanding of the literature and from the manufacturer,
Not a big
not an
deal.
issue.
Okay. Last thought that you want to share with everyone, Christopher? I know
No.
you have to get back to work.
Yes, just thank you. Thank you for having me. Thank you for informing the community. And again, patience, persistence, and remember, the most important thing that you can do in absence of a vaccine is wear your mask. Wear your mask, wash your hands often. And if you're sick, stay home and get a COVID test. And we will get through this. We're getting through it a year, coming up on a year. And I think I have a feeling if we continue to vaccinate and we continue to get more vaccine, I'm hopeful that the summer and fall of 2021 will look a little bit different.
We all hope so.
Thank you
Okay.
for having me.
Thank you. Thank you,
Well,
Christopher.
Christopher Rinn, the CEO of the VNA Community Health Center, thank you very much for being with us today. And always remember, if it's important to you, it's important to us. I'm Andrea Tarr. We will see you next week on Scan FYI. Bye, everyone. Bye, Mary
Good
Beth.
day. Have a good day.
Good day.